Hi, welcome to today's video where we are going to show how to do a DACODS admission. From this menu screen, you'll go to see the bar across the top. Go to the DACODS icon, drop down one and type or select DACODS Add. The DACODS Add will take you to the admission screen. You'll notice at the top there are two tabs. One is an admission, one is a discharge. We are going to concentrate today on the admission tab. One of the tests you can do at the beginning of this is to select enter right away, and the system will show you which fields are required. At the top, it will show you a verbal listing of all the fields that are required. But if you go down a little bit, scroll down, you will also see as the fields are put on the screen, it will also indicate in red the fields that are required. Now, as a provider, the first thing you'll see on the screen is the sub-state planning area, the SSPA. That should be filled out for you based on your permissions and your location. Your license number will also appear already filled out and grayed out. You cannot change these based on your security profile. So the first field that we're going to talk about today is the first contact date. This is a field that is required, and it is a field that will let us know the first time a client contacted you for treatment. You'll notice to the right, there's a little bit of a calendar icon. Click on that calendar icon, and you can select a date. For today, we're going to use February 1st, 2024. Now, for our second field, we are looking at first appointment offered. This is the first available appointment that you are offering that client. That does not mean that the client will necessarily take that appointment, but it is the first one available. The BHA often looks at the time between first contact date and first appointment offered to look and see how the abilities for providers to response times. So again, clicking on that icon, you would have to select something at least equal to or greater than February 1st. For this session, we selected February 2nd. Now, the admission date does not necessarily equate to the first appointment offered. Perhaps the person cannot make February 2nd and cannot show up until February 4th. So here on the admission date, when the person actually shows up to get their first screening or treatment, this would be the date that you would select. So again, first contact date is the date that you first hear from this person that they want treatment. The first appointment offered is going to give us an indication of when you had something available. And the admission date is when the client actually does show up and begin either treatment that day or at least getting in for their initial assessments. We've moved down now to last name. This is obviously self-explanatory. The last name and the first name are required. I do want to point out that we did go past a couple of non-required fields. One is the Medicaid number. If a client is currently has a Medicaid number, even if this treatment is not being paid for by Medicaid number is a very useful identifier in order to do care coordination and understand the entire episode of a client. So if someone is enrolled in Medicaid, we would appreciate you putting their number in here. Again, it's not required because not everybody's going to have a Medicaid number. The provider client number is the number from your system. So if you have a person that's coming into your treatment and you assign them a number, you can put that number in here. This will allow you an easier time to search for this client and to be consistent with your records. This is, again, not required. This is not a client number that we are assigning. This is the client number that you have assigned this person. Once again, we'll put in a random last name, first name. This is obviously a required field. You will notice that there's also a middle initial that is not required. Now, the CCAR unique ID is a a field that we use primarily for people that are receiving mental health and substance use services, known as co-occurring. You would put in their mental health agency number here, the first 3 digits here in the first box, and then again their client number that was used on the CCAR in the second box. So if this client has both a DACODS and the CCAR, you can put their CCAR agency and client ID in here for matching later. Next box is your date of birth. This is also required and also comes with a handy dandy calendar. I myself don't like to use the calendar here because generally speaking, we're talking about clients that are several years old. So sometimes it's just easier to put the date in here instead of tabbing across several years. Social Security number is not a required field because, as we know, not everyone has a Social Security number. It is highly recommended if the person does have a Social Security number. Again, this is the best way that we can ensure people are getting care across the systems and getting good continuity of care by using the Social Security number. Finally, for zip code, we use the 5-digit zip code. We don't use extensions at this time. Now, we also understand that we serve many in the homeless population. If your client is not currently residing in a home, you can click on the client is homeless, or if this person is out of state. If someone, for instance, is from Wyoming or New Mexico, one of our neighboring states, you can click out of state zip as well. If the client is not homeless or is not out of state, then we would put in here the county of residence. We have a drop-down box, as you can see, in alphabetical order, listing all the counties in Colorado. Now, here we go into our admission modalities. This is the type of treatment that the clients are receiving. We have several different modalities that we can talk about here. There are several residential cares. You'll notice a differential assessment is when a client receives an assessment, but ultimately doesn't choose to select treatment. We want to make sure that you get credit for delivering that assessment, even though the client did not end up taking treatment. You will see here that we have several different options: opioid replacement therapy, different outpatients, intensive and traditional. If you're curious as to which modality to select, please look at the DACODS manual where we have more in-depth definitions of all of these types of modalities. Now, the field next to it is days waited to enter the treatment facility. This is very similar to what we did with the first contact and admission date. One of the things especially important is if your client is a priority population, that is someone who is pregnant, who has dependent children, or is an injecting drug user, we would like to see those clients entered immediately. But if that is not a possibility, we would like to make sure at least that interim services are offered, which is the field over to the right. If someone had to wait for services that fits into this category, we would want to see this selected as yes. Remember, it is a federal rule that we make sure that pregnant women are seen either immediately or provided interim services. Now, the next fields here, we're looking for prior detox episodes across a client's lifetime, number of prior substance abuse treatment episodes. This will give us an idea of how, if this client has been in treatment before, or if this person has had prior detox episodes as well. Let's go ahead and put one for each. On gender, the TMS system is an extremely old system. We are still only allowed to select male and female at this time. Again, use the federal definition of gender at birth for now. We are obviously looking to upgrade this with the new modernization of TMS. Sexual orientation is also a required field here. Select any of those categories. Client pregnant, this is obviously an important one. Let's go ahead and select yes on this, and you'll see that it will allow you then to also select Special Connections. Special Connections means that you are part of the program in which HCPF pays for most of the treatment that the pregnant woman is receiving. You will also notice right next to the client is pregnant drop down, there is a chance to click on the Special Connections program recently expanded their care to not just care for people who are pregnant, but also postpartum for several months after pregnancy has ended. And finally, this report type is a treatment admission. Going down to client's race, this is one of those type of boxes where you can select more than one. Let's say someone is both Asian and Hawaiian, for instance. You can select both of those categories. This allows our clients to be a little bit more definitive if they come from a multiracial background. You will also notice that we have a Hispanic in the ethnicity category. And here again, you can look at several different categories, including Hispanic Mexican, Cuban, or Puerto Rican, or of course, if the client is not Hispanic or other. Now we get into your basic demographic fields. Marital status, you can select from this category. Client's income level, this is their monthly income. So if someone is making, say, $60,000 a year or $24,000 a year, you would put $2,000 here. And the number of persons living on client's legal income. This is one of those tricky ones in that the client would always count as one. So if someone is married without children, for instance, this number would be two. And obviously, if they have children or someone living with them, maybe an elderly adult, those would all count. So this always has to be at least one. Here we have number of children. Again, if they do not have children, a 0 would be appropriate here, but you have to fill this out. Military service is the next field we require. And again, if you have any questions about any of these demographics, they are explained further in the DACODS user manual. Going over to the client's living situation, you will see, again, a very long list of options here. Now, remember up above where we were clicking on homeless? If you clicked on the homeless button above, please be consistent here and click homeless here. Again, these can be very confusing, so please refer to the DACODS manual for definitions of all of these different types of living situations. Needless to say, if the person is living outside of one of these facilities, it would fall under the independent living category. Client disability, very similar to our race category above, has the ability to have multiple disabilities. So this is not where you have to select one. So the only thing you cannot do is select none and then try to select one of the different disabilities. If someone is disabled, as here we have clicked on deaf hearing loss, then we would ask if the client requires reasonable accommodations. If they say yes to this, then another question will come out asking if you provided those accommodations. The next section goes through more demographics where we look at highest grade completed. Once again, if they have a high school education, that would be 12. If they have a college education, that would be 16, etc. If the client attended school in the past 3 months, this is to basically see if the child is still going to school. If they're not of school age, of course, you can click that button. So let's say you were admitting someone who is 30 years old. You would not select no, you would select not school age. Current employment status, very similar to the drop-down boxes earlier, where we talk about employed full-time, part-time, or several other out of the workforce selections here. The primary source of income, again, select from the best option. We all know that many people receive perhaps multiple forms of income, this would be the one that gives the most income for that person. The same thing for primary source of payment. What pays for most of the treatment? We now have an encounter file that gives us better indications of different encounters and what they're paid for. But if this was paid for, let's say through MSO funds, even if it's not all paid through MSO funds, that would be the selection. If Medicaid was the primary payer of most of the services, it would go there. So again, we know that most of these cases are complicated and there's not usually one source of payment. We're looking for the source of payment that pays for the most. You know, we sometimes say payer of last resort. This would be payer of first resort, if you will. The other thing that we want to track is health insurance, if the person is insured or not. Now, you'll notice we're not asking whether the client is being paid by insurance. We're just simply looking at this point whether the client has insurance or not. The next selection will ask whether that insurance covers the treatment or not. So those are two separate questions. Here is back to what we were talking about when we talk about someone having a CCAR or having a mental health issue. This is where you would select yes if that person has a CCAR, or no if the person does not have a CCAR or does not have any mental health that you're aware of. You can select unknown. Because co-occurring clients are very important and a very tricky population to treat, we would like you to make your best clinical assessment here and try to obtain whether that person is a co-occurring client or not. And then finally here, has the client ever experienced or witnessed a traumatic event? Very similar to the question before. Use your best clinical judgment in here, but in the case of when you are unable to assess that, you can collect that as well. Transfer referral source, this is also a very important field. It is required, and this is basically how did this client come to find you. You'll notice many people may use our directory, OwnPath. That would be someone then that would set to individual. But if they came from the court system, they may come from the non-DUI criminal or the DUI, DWI criminal justice. Many different types of programs here. The crisis system is a good one. If they came in through the crisis system, we would like to know that. We want to make sure people that are in crisis are getting into proper treatment at some point. The next four questions are looking at family, socializations, education, employment problems, and medical physical problems. Again, please use your clinical judgment to base them on slight, moderate, or severe. All of this is in the DACODS, the user manual. Now, when we get into the substance use treatment, we want to know what is the primary drug that's being used here. As you'll see from left to right, we allow 3 different types of drugs to be treated for: primary, secondary. With the first one, we select, let's say, alcohol. Whoopsie daisy do. I took so long blathering, we ran out of time. Let's go back to that screen. This is a lesson for all of you filling out the DACODS for the first time. Because this does have PHI information, this screen will log off after 15 minutes of non-use. And while you're saying, wait a minute, we've been typing this whole time, that would be 15 minutes without entering the submit button. So we will put some quick information in here and get back to where we were. While we're filling this out, just a note that when we go to do the discharge, many of these fields will have to match, including the primary, secondary, and tertiary drug type. So just something to keep in mind. So if someone changes or you discover different drug types as they do their treatment, the way to do that would be not to put those in at discharge, but to actually update the admission record so that it is a accurate representation. Now, while we're filling that out, you can see below there, we have the primary, secondary, and tertiary drug types. Again, much like many of our boxes, we have a drop down that you can select several different types of drugs. You do not have to fill out secondary and tertiary. The only thing that is required is primary. So if you're treating someone for alcohol and that's it, you would not have to fill out secondary. Now, with the diagnostic impression, let's go back up to that drop down. You'll see a couple of different options: abuse, use, and dependence. What this is used for is when we send this information to TEDS for our block grant, we take this use, abuse, dependence and translate that into a diagnostic code that we then send over to the feds. Usual route of administration is the one right below that. And that talks about, again, how we ingest the drugs. So we could have oral, we could have injecting. Once again, if this person is doing injecting, this becomes a priority population and injecting drug user. Right below that, you'll see age of first use. What we're looking for is to say, when did this person start using their drug, and then how long did it take them to end up in treatment? This is used for the CDPHE drug trends report, among many other things. Also, we want to know if they are using illicit drugs, what's the source? How did they get into this? Are they getting this from family? Did they start getting this in school or off the internet? All of these different things. You'll see one of the most common that we see, especially around the opioid crisis, was around prescription drugs. So all of those are legitimate responses to this question. So if the person, let's say, does not have a secondary or tertiary drug use, under secondary, you would select none, and the system will then know that you don't need to fill that out. If, however, you select a drug here, it will open up those boxes and you would fill out the same information as you did on the primary drug type. And then here, we are looking for how many visits have you to a medical emergency room? How many times was the client admitted to a medical hospital, psychiatric emergency rooms, or psychiatric hospitals? Here we have the number of DUI or DWAI arrests in the last 30 days prior to the admission. Number of other arrests in the last 30 days. And frequency of attendance at self-help programs in 30 days prior to admission. And as I'm going through these, I realize I skipped over a very important field up in the primary drugs. How many days in the last 30 did you use your substance? This one is a controversial one because it is literally how many days in the last 30. So many times someone may be coming out of a residential setting where they have not had any use in the last 30 days, but still have a severe drug problem. It may seem counterintuitive, but the answer would still be 0, that this person was in a prison setting or some sort of controlled setting where they weren't in. Many people have asked the question, well, maybe the question should be how many days in the last 30 when you were using in your last time that you were using, but we have checked with the feds and it is the way it's written out. So if someone was in a controlled setting, it is okay here to put 0 and abuse. All right. Finally, we're getting to the very end here. Is the client covered by the interstate compact? This is a situation where they have had legal problems in another state, usually around UAI, where they have been entered into the interstate compact, and they would need to work with that to get their driver's license back. You can select yes or no. Daily tobacco use, cigarettes, chewing tobacco, all of these things are available here. And finally, statutory commitment at admission. Again, this is if this client fell into the ICEC program, involuntary or emergency commitment. If they are not held under that involuntary or emergency commitment, please enter none here. At this point, you've gotten through the day codes, and you would select Add as the button to enter this information into our database, and you will see right here at the top, record successfully saved. And that's it. That's all you have to do to fill out a DACODS admission.